Good afternoon, everyone. Thanks for joining us for our COVID-19 Professional Education Quickenar. My name is Matt McDonough. I'm going to be your host for today's event. And on behalf of the entire ESRD National Coordinating Center, I want to thank you for joining us for today's Professional Education Quickenar. These Quickenar events are held weekly. They're in partnership with CMS. And these 30-minute events feature subject matter experts from around the country sharing how they or the organizations that they're with are coping with the situations related to COVID-19. And before we get started, I did want to let you know that we are recording this call, and a recording and the slides for this event will be posted to our NCC Quickenar page, usually within 72 hours, oftentimes a lot faster than that. So let's take a look at our agenda. We're happy to be joined today by two speakers from the Centers for Disease Control and Prevention. We have with us Dr. Shannon Novosad, and also joining us is Stephanie Booth. Today, they're going to be talking about the CDC's COVID-19 infection prevention resources for dialysis staff. As our speakers go through their presentation today, obviously there may be questions that come up, and we invite you to submit them at any time using the chat feature through the WebEx, or using the Q&A panel, which will be in the lower right side of your screen, or the WebEx menu, depending on what your view looks like. When we get to the Q&A section of this presentation, we'll share any questions that we've received with our speakers, and our goal today, as always, is to answer as many questions as we can as time allows during today's event. And this call is about reviewing today. Obviously, we said reviewing the CDC's COVID-19 resources. We're going to discuss some videos and some tools to help staff stay safe and manage their own COVID-19 risk as they perform their tasks, and hopefully provide some strategies for staff and facilities to put into use as they go about their daily work. So now I'd like to introduce our speakers. Dr. Shannon Novosad is a medical officer on the dialysis safety team in the Division of Healthcare Quality Promotion at the CDC. In 2015, Dr. Novosad came to the CDC as an Epidemic Intelligence Service Officer assigned to the Division of Healthcare Quality Promotion, where she investigated outbreaks in healthcare settings. Her area of concentration included prevention of central line-associated bloodstream infections and increasing safety of patients on dialysis. Joining her is Stephanie Booth, who is the Infection Prevention Coordinator for the Making Dialysis Safer for Patients Coalition. Stephanie has a degree in healthcare administration, a certification of infection control, and she's contracted by Northrop Grumman in the Division of Healthcare Quality Promotion at the CDC. Stephanie has over 15 years' experience in the dialysis setting as a certified tech, biomed tech, clinical coordinator, and educator. It's my pleasure to turn our event over to Dr. Novosad.
Hi, everyone. Thanks so much for having us talk today. Looking forward to sharing this information. And again, I think we'll have time at the end for questions. Next slide. So I think first I'd like to highlight what you see here on this slide. This is our interim, I'm going to give you the long title. This is our Interim Additional Guidance for Infection Prevention and Control Recommendations for Patients with Suspected or Confirmed COVID-19 in Outpatient Hemodialysis Facilities. And this is available on the CDC website. Many or most of you or all of you potentially are already aware of this guidance, but I wanted to point out this page. And as you'll see, what we did on most of these slides is provide kind of the web link at the bottom to make it easier for you to find. Again, point out this page because it not only houses the guidance document itself, but it also has links to related pages and resources for the dialysis healthcare setting. And all of the additional resources we'll discuss today are really based on this guidance. And we're going to point out some parts of the guidance as we review these resources. However, we're not really going to have time to cover all of the information. So again, encourage you to review this page as well if you haven't seen it. And an important point I always like to emphasize is that this guidance is based on what we know now. We're still learning about COVID-19, and when new information becomes available, we'll change our guidance as needed. So it's always important to try to review this periodically. One recently released resource we have is the Frontline Staff Toolkit for Outpatient Hemodialysis Facilities. This is a new resource that highlights the importance of infection prevention and control practices in outpatient dialysis facilities to slow the spread of COVID-19. Staff who are having frequent patient interactions and providing direct patient care in outpatient hemodialysis facilities are encouraged to watch and learn more about how everyday infection prevention practices, as well as some additional practices that are essential during COVID-19, really help prevent the spread of infection. We want to emphasize with these videos that many of the practices you engage in on a daily basis are essential for preventing the spread of COVID-19. There's 3 brief educational videos in the series, and they can be viewed as a set or in segments as time allows. Next slide. So here on this slide, you can see the first video, which outlines, again, basic infection prevention steps that the staff, are doing every day to keep patients safe and prevent infections, and explains in more detail why hand hygiene and environmental cleaning and disinfection help prevent the spread of COVID-19. Some key points here about the cleaning and disinfection procedures include that the routine procedures that you're doing are likely appropriate for COVID-19, but you need to make sure that you're using an EPA-registered disinfectant that's designated for use against SARS-CoV-2, the virus that causes COVID-19. The EPA has a list of these products called List In available on their website, and the link for that is on this slide, or the link's also available on the CDC website. For dialysis, it's especially important to ensure that the product you choose has a bloodborne pathogen claim as well. And so if you've taken a look at this list, you may see that the products you are already using could be on this list, and in fact, many of them probably are. However, don't assume that you don't need to make any changes. You should definitely still review the instructions for use to ensure that you're using the product as directed. So that includes kind of the particular concentration needed and contact time required. And then another key point is that any surfaces, supplies, or equipment located within 6 feet of a symptomatic COVID-19 patient should be disinfected. And if it can't be disinfected, it should be discarded. Next slide. So here's a second video, and this reviews the personal protective equipment, or PPE, that's used in dialysis facilities, and explains how and why correctly using PPE helps prevent the spread of COVID-19. So remember that PPE protects you, the healthcare worker, from infectious materials such as blood or body fluids, but also helps prevent the transmission of pathogens between patients. So just to kind of review the list of recommended PPE for healthcare personnel taking care of suspected or confirmed COVID-19 patients. So first is an N95 or higher level respirator or face mask if a respirator is not available. A cloth face covering is not considered PPE and should not be worn by healthcare personnel when PPE is indicated. And respirators should be worn by fit-tested personnel in the context of a respiratory protection program. Next is eye protection. So this can include goggles or a disposable face shield that covers the front and sides of the face. And remember that personal glasses and contact lenses are not considered adequate eye protection. Third are gloves, and then finally an isolation gown. And important to think about this in dialysis, that the isolation gown should be worn over or instead of the cover gown that's normally worn by hemodialysis personnel. If there are shortages of gowns, they should be prioritized for initiating and terminating dialysis treatment, manipulating access needles or catheters, helping the patient into and out of the station, and then cleaning and disinfecting patient care equipment in the dialysis station. And when gowns are removed, make sure they're placed in a dedicated container before leaving the dialysis station. Disposable gowns should be discarded, and cloth gowns should be laundered after each use. We'll discuss a bit more about PPE conservation strategies in the coming slides. But again, this video covers this information, has some also links to additional information, again, on how to properly don and doff PPE as well. Next slide. And here's the final video, which outlines the steps for screening patients before dialysis treatment and explains why appropriate patient placement can help prevent the spread of COVID-19. And again, highlights important concept of screening or triaging before patients enter the facility, which really reduces exposures for other patients and healthcare personnel, helps prevent the spread of disease within the facility, and helps ensure that PPE is used effectively. So as you guys are probably aware, the process for screening will really depend on your facility layout and staffing. So for example, you may have an area outside of the facility where screening can occur even before patients enter the building, or you could be, in a building without, such an outside area, and maybe a staff member then needs to kind of be stationed kind of immediately inside the door to the lobby or waiting area. So we go kind of through some of those strategies here in this video, and it also discusses where symptomatic patients are placed for treatment and how that may vary from facility to facility. Next slide. So as I mentioned, the second video in the series discusses PPE use, but I also want to note that there's other information available on the CDC website in regards to PPE that could be valuable for your facility to be using right now. It includes information on conducting inventories of PPE on a regular basis, and the link shown here on resources on how to help with optimizing the use of PPE in the event of any shortages. So I think, as we all know, PPE shortages have been occurring and are still occurring, and really presenting a tremendous challenge to the U.S. healthcare system during this pandemic. And, healthcare facilities across the spectrum, including dialysis facilities, are having difficulty accessing needed PPE and are having to identify alternative ways to provide patient care. And so we won't go through all the details of what's here, but as you can see on the slide, there's information specific to each type of PPE. So again, I think it's good information to read if you haven't seen it. But what I do want to highlight are kind of three strategies or definitions that you may not have heard before and are outlined in this resources. And so these are kind of the three categories or ways PPE can be used when surge capacity is happening. And these can really be used as ways to kind of prioritize or conserve PPE. So the first one's pretty easy. It's the conventional capacity, and this is really kind of how you would normally use PPE. So it consists of measures of engineering, administrative, and PPE controls that should already be implemented in general infection prevention and control plans in the healthcare setting. So again, this is really what you should be doing on an everyday basis when surge capacity is not happening. Contingency capacity are measures that may be used temporarily during periods of expected PPE shortages. And then finally, crisis capacity is when strategies that really are not commensurate with our U.S. standards of care, but unfortunately have been considered or enacted by certain facilities during extreme PPE shortages. And so the reason I pointed these out is because there's really a continuum of options for use of PPE, and these should really only be used when PPE supplies are stressed, running low, or absent, and really used only to augment, again, conventional capacity measures when it's an urgent need, and that really they should be implemented sequentially. So a facility or your facility really shouldn't be jumping straight from conventional capacity into crisis capacity without kind of taking into account some of the in-between measures that can be taken. And that as PPE availability returns to normal, healthcare facilities should promptly resume standard practices. So again, I think this is really valuable to review and just think through how PPE is being currently used in your facility and where you kind of fall in these definitions, whether you're doing conventional, contingency, or crisis capacity, and can kind of think about which of these groups you should really be falling into right now. Next slide. And then this is another resource to point out that you may have used already during the pandemic, but I think it's always good to come back to it. And this is our COVID-19 outpatient dialysis facility assessment tool. This tool was created to help outpatient hemodialysis facilities prepare for the possible or current arrival or pending arrival of patients with COVID-19. It's relatively short and contains pretty focused questions under each element that, again, are really based on the guidance document that was shown in the very first slide. It's not a list of mandatory requirements. Rather, it really highlights important CDC recommendations and, again, is meant to, kind of accompany the guidance document. And this tool can really be used by, staff at all levels at the facility. So nurse managers may use it to check if the facility is prepared. Dialysis techs could review it to understand the guidance and become familiar with changes, that they're seeing at their facility. Health departments can use it. So we really think it can be used kind of in a variety of ways. And again, really should be used in combination with the guidance document. Next slide. Other resources available on the web right now include 2 fact sheets that are shown on this slide. The first is how our facility is keeping patients safe from COVID-19, and this is an informational handout for dialysis facilities to share with patients and caregivers to explain how they're preparing or have prepared for taking care of patients with COVID-19. And then the coronavirus disease in 2019, keeping patients on dialysis safe. And this is a handout for patients on dialysis to learn more about COVID-19, what it means for their daily activities and for their dialysis treatments. It provides information on practices patients can expect to see in their facilities, as well as some questions patients can ask staff to learn more about COVID-19 prevention activities happening in the facility. And then also shown here is a third resource. It's our screening and triage at intake for dialysis patients. This includes some general steps for screening patients for COVID-19 at intake, considerations for staff, and then steps to take after a patient is screened. It does cover some of the same information that's in the third frontline staff video, but provides some additional details and can be used to supplement that resource. Next slide. And then here, in addition, we have a web page titled Special Considerations for Patients on Home Dialysis. This includes suggested discussion topics for home programs to use to facilitate discussions or educate their patients. And also does recognize the need that there may need to be changes in how kind of the routine follow-up of home dialysis patients that are being conducted. For example, covers, the use of remote or televisits, and does kind of have a little bit of a reminder to facilities that they should coordinate with home dialysis supply companies to ensure that supplies continue to be delivered to patient homes and stored appropriately. And again, this is really kind of meant to be more as not really a conversation starter, but a tool to get home facilities thinking about, how they can engage their patients with COVID-19 education and prevention. We also created a fax or an FAQ webpage called Considerations for Providing Hemodialysis to Patients with Suspected or Confirmed COVID-19 in the Acute Care Setting. And this was really developed in response to some frequent inquiries we were getting from this setting, and includes information on PPE to be used in the acute care setting for acute care dialysis staff, placement of COVID patients undergoing dialysis in the acute care setting, and information on whether a negative test for COVID is required before a hospital discharges a patient back to an outpatient dialysis facility. And this is set up more in an FAQ type manner with like a specific question, and then information underneath. And then lastly, there's a PowerPoint presentation that can be used for training on our guidance, and this can be, again, utilized by staff at various levels. Staff can just take a look at the presentation versus, it can be used as, part of a training or an in-service, and I know it's also been utilized by some health departments as well. Next slide. So that's all the information I have to cover. Again, it was really designed to do a quick tour through all of the resources that are available on our kind of dialysis page, and maybe to give you some ideas on how you can incorporate these into, current work at your facility. So thanks again for letting us present these today, and definitely feel free to email us here at dialysiscoalition@cdc.gov if you have any problems locating these resources or any questions about them.
Thank you, Shannon. I'm going to leave this slide up so that folks can have this contact information visible for the next few minutes. And before we do get into our questions and answers, and we've received a few so far, I do want to remind you that if you do have a question for our speakers today, you are invited to submit them using the chat or the Q&A panel. You can do that at any time, even while we're answering some questions. We'll get through as many as we can before we begin our wrap-up tonight. So Shannon, the first question I got was, and this came in from one of our attendees, is the CDC still recommending, or do they anticipate changing the recommendation that all patients and staff wear masks throughout treatments with the changes that are happening in location policies?
Yeah, I don't anticipate any change to that guidance anytime soon, really. I think, the issue of source control, I think, is, still really critical for preventing transmission of COVID-19. And because it can change in different areas, I know, maybe perhaps your facility could be in an area where there's no transmission or really no cases. But I think, given that we know people are on the move and things are happening, I think, and obviously we will definitely update people as this changes, I think this is going to continue to be a kind of a blanket policy for the foreseeable future.
And there was another related question to that. Obviously, the ESRD networks that are, our facilities that are on this call work with are a great source for information of updates. Is there a particular place, I see cdc.gov there, is there a place where folks can go or sign up, a Twitter account or a mailing list, if those policies are updated in the future, that they might be published or archived in a certain area?
That's a really great question, and I actually don't think there is, but I will check and see if I know anything about that. We do have, I think, information on the website. As we update it, we do update the website, and we try to put, like banners and stuff at the top indicating that part of it was updated. But I agree, it is definitely hard to, I think, to keep track of when the updates happen and everything. So let me check, and I can always get back to you guys with that. Let you know.
Definitely. And of course, for the facilities that are on this call, your ESRD network is always a source for updated information as well. So we just don't want you to forget about that either. Interesting question came in here. That's a little bit of a longer question. So, but I think it's very interesting. And the question is there any safety issues in using an oxygen concentrator for dialysis patients, even in a COVID-19 cohort facility? I think it's specific to that, because in a regular dialysis facility where you're not doing any tests, all patients are viewed as PUI. But in a COVID unit, when you're using an oxygen concentrator, this person feels that the atmospheric contamination may be funneled to the patient's airways. Is that a concern, or is that insignificant?
Just to make sure I have the question straight, so this is in terms of you being kind of used in a COVID-specific unit? Was that the question?
Yeah, I think that was the scenario that was asked under.
I don't think we have any specific information on like that a concentrator shouldn't or shouldn't be used in that setting. Especially, I think if it's in kind of the COVID-specific unit, I think that, while theoretically you would think there could be more COVID in the atmosphere, in general, all of the patients there should already be diagnosed with COVID. So I think that would negate some of the risks that they could be worried about there. In general, we don't have any recommendations, though, that an oxygen concentrator should or shouldn't be used, I think, in any of these units, because we haven't seen any evidence, I think, of transmission associated with them. And so I think it's, again, I think I'm interpreting it as the question is being related to, is there a specific risk to the patient? So if there's additional clarification of that, let me know. But again, I think as of now, we don't think that there's any increased risk with using them to the patients there.
And I think that's what was being asked. So thank you.
Okay.
General question here. Based on what we have learned or are currently still learning during this, does the CDC anticipate that the infection prevention procedures or policies will permanently change once we get past this pandemic? Are there going to be some permanent alterations to guidance that's happened in the past?
We don't know for certain, and I think, it is something that we are definitely starting to hear more questions about, and that, that we're probably thinking about. I think it's still too early to tell, but I do think that, this pandemic in general, highlighted, how important some of the basic infection prevention practices are, and some things that we may need to continue doing long term. just in terms of, better screening and understanding, respiratory symptoms during respiratory viral season, and, did highlight issues with, kind of some of the lack of, respiratory training programs or fit testing for, N95s and stuff in dialysis facilities. So, I mean, the long answer is I don't know if anything will permanently change in terms of official guidance or recommendations. But again, I do think that, this really just brought to light, I think, issues that we need to start thinking about and how to kind of just better operationalize kind of in everyday practice. I think, particularly around kind of those two areas. But I don't know, Stephanie, I don't know if you had any other thoughts.
No, I think you covered it all. I think that, again, it did bring to light a few of the issues that we may be able to focus a little more on. Every time we have something like this, sometimes it can be good. And I think that it really is making the dialysis clinics focus on the education aspect and on the screening and triage aspects, which could be a good thing for dialysis clinics in the future.
Absolutely. We've got 3 more questions, it looks like, so we'll start at the top. This question comes in, what are the CDC's recommendations for testing patients with ESRD, many who are greater than 60 years old or diabetic, hypertensive, and are generally considered at greater risk than the general populations?
I'm sorry, I think I missed the first part of the question. Could you read it again?
I sure can. What are the CDC's recommendation for testing patients with ESRD, many of whom are greater than 60 years old and have comorbid conditions or, hypertension, diabetes, and are these greater risk patients?
Yeah, so I do think, there's still a lot of work going on in terms of, epidemiology and understanding who the high-risk groups are. But I think we've definitely started to see in the data that, ESRD patients are at, in a higher risk group, meaning, they get, sicker with COVID-19, higher mortality and stuff. So we definitely do consider them in the high-risk group. And, other comorbidities, as were mentioned, age and cardiac disease and others are definitely there. So in terms of being a high-risk group, I think they definitely are. I think in terms of testing, we do defer a little bit to local and state health departments in terms of how they decide to test. So we don't have, I'd say the recommendations for testing in dialysis clinics are maybe a little bit different than what you hear about in long-term care settings where there haven't been, quite as broad recommendations to test universally. So it's different in that, we're not saying that everyone in a dialysis clinic may need to be tested. But I do think that, dialysis patients or ESRD patients do need to be included in the high-risk group and as such should be, prioritized for testing just due to their high risk and kind of the intrinsic nature of the dialysis clinic where it's very important to understand if someone is infected in order to prevent transmission to others. So I would say that, we definitely advocate for testing in this group and think they are a group that needs to be tested. But in terms of broad testing of everyone in a particular clinic, we don't currently have recommendations for that like we do in the long-term care setting.
Very good. Thank you. Second to last question. This is a PPE-related question. Can the same isolation gown be used for multiple patients that are under investigation and that are being cohorted as long as they're in the same cohort category?
Yeah, so I think in, the ideal world, if there are no PPE shortages, we would say that, the isolation gown should be changed after each patient or each patient encounter. So again, ideally, so thinking about where you at or where your facility at is on kind of that spectrum. If it's, normal conventional capacity, the gown would definitely be changed between patients or moving between patients. But if your facility is, more in the, the crisis standards and moving along those lines, it is possible that, they could implement some extended use. But again, you would want to really only do that kind of in groups of patients where the diagnosis was confirmed. So like, where you knew all patients were COVID positive or all patients kind of were COVID negative. You ideally would not be, reusing it all. And then I think the next tier would be not reusing between patients with different diagnoses.
I think that answers the question perfectly. Thank you. And our last question, are there any recommendations regarding visitors to dialysis facilities?
Yeah, so we definitely have discouraged in general, when this whole pandemic started, keeping visitors out of, all kinds of healthcare facilities as much as possible. Just, thinking through transmission and preservation of PPE and a lot of other issues. And so I know in dialysis facilities, kind of the same idea applies, just limiting visitors as much as possible. There have been some loosening of these recommendations, I would say, in some areas. So while we don't have a specific rec that visitors, should or shouldn't be, I think, allowed in the dialysis facility, I think it's still really at the discretion of the dialysis facility to know kind of if they're ready and are able to absorb having visitors back in terms of, what their capacity is and stuff. And again, just because, a lot of our recommendations are still going to apply, I think, for the foreseeable future in terms of everyone needing to, do source control and screening. I think even in areas without, a lot of COVID transmission, having visitors in the center could still be, quite a burden to the dialysis facility in terms of having staff to do all that. So I think there could be many reasons that facilities could potentially still be limiting visitors right now.
Certainly. I know we're at our time, but one last question just came in. I think it's a really good one and maybe useful. Are there written guidelines from the CDC for how to work in a COVID cohort unit, such as screening protocols, PPE use, et cetera? Is that a resource that's already out there?
So we don't, specific to dialysis, no, we don't have that resource developed. We have, done some consultation with some places and talked through with them. And so, if there are facilities that are working through that, we're definitely happy, to help think through that with them as well. I mean, in general, really the same principles should apply in terms of, all of the recommended PPE and such. But, sometimes I think operationalizing that is a little bit difficult to think through. And so I think, we're definitely available as a resource to help with that, either, through the networks or health departments or whatever. But there's not an official guidance document for that.
Great. Shannon, Stephanie, thank you so much for your time tonight. I know we're running a little bit long, but I had a bunch of questions, and we're so glad you're able to stay with us and help get them answered. So thank you for your time again.
Oh, can I give you one? This is Shannon. Can I give you one update? Actually, while we were doing that, I did get the information that there is a link on the CDC website that you could check that kind of highlights the resources. So instead of, it used to be that you would have to go to each specific resource and then you could see at the top of the page if it was updated. I think they have now developed a web page that consolidates that a bit more. So I can send that link to you if that's helpful to send out to folks.
That would be wonderful, and we can send it out to anyone who's attended today. Thank you.
Okay, great.
Great. Thank you so much. Appreciate your time this evening.
Thank you.
Thanks, everyone.
Thanks. Before we do wrap up our event, we want to highlight the kidneyhub.org. This is a secure, mobile-friendly web tool for patients and professionals, and it's being updated with new information all the time. New features on the tool now feature the patient grant library and videos on understanding high KDPI and increased risk kidneys, and more. So it is designed to be visited and viewed on a mobile device. So we encourage you to take a visit to thekidneyhub.org. Our next COVID-19 Quick and Our events are next week. Our patient event is Tuesday, June 23rd. That's 5 p.m. Eastern. And our next provider event is Wednesday, June 24th. That's 1 week from tonight. Both of those events are out on the www.kidneycovidinfocenter.com. You can go out and view those events and register for them now. And of course, we would certainly love to have you on either of those two events next week. So I know we're a bit over, but I want to thank you for your time today. Our NCC contact information is on the screen, as well as 3 additional resources for COVID-19 information if you are looking for additional sources of information. So on behalf of the NCC, myself, Thank you for attending tonight. We hope you found this event informative. Again, thank you to our CDC presenters, and we hope that we'll see everybody on a future Quick in Our event. Have a wonderful night.